Jen starts right now.
Well, now switching gears, it takes years to get through medical school, and somewhere along the way, notes and lectures must give way to real live patients.
So how do students make that leap? Well, the Philadelphia College of Osteopathic Medicine has come up with a cutting-edge way to enable their students to do so. Check it out.
What's your name?
It's Piper.
Piper?
We've got a laceration on the leg.
This is on-the-job training for medical students here at the Philadelphia College of Osteopathic Medicine.
Do you know what kind of medicines you're taking?
No, I know I take some pills, but I don't know what they are.
The catch?
How does that play into it?
Piper is a standardized patient simulator that can be programmed to mimic dozens of real-life emergencies.
She can be anybody we want her to be. But basically, she replicates all the bodily functions that any person has and can be examined any way we want her to be examined.
Technician Ryan McKiernan sits behind a two-way mirror to help bring the patient to life.
No, my chest and my leg hurt.
To add to the realism, a computer program makes her chest move up and down. It also triggers her eyes to blink and react to light. This dummy is so sophisticated, she even bleeds.
So you might want to consider doing something with that.
Okay, so
Direct pressure on
direct pressure. We should put an IV in, guys.
Which IV are you going to start?
PCOM instructor and surgeon Dr. Arthur Sesso says as far as his students are concerned, this simulated patient is just what the doctor ordered.
Today, the number of hours that a person spends in a clinical setting are limited, especially our interns and our residents. And so to get the practice that someone like I got maybe 20, 30 years ago is not possible today. And it's also not acceptable to make errors on patients.
Besides Piper, PCOM students and doctors also hone their skills with specialized machines like this laparoscopic simulator.
As we pull on the instruments, we can feel the pull on the organ.
The hope is this extra hands-on practice will end up making better and safer doctors.
It allows you to make mistakes, to learn from your mistakes, and possibly fix a mistake that you're going to see every day.
Fellow student Jill Friedman couldn't agree more.
You always hear that expression, practice makes perfect, and you can go through these simulations so many times, and it's important because you'll make mistakes and you're also going to learn, and you could bring all that information with you to when you see your real patients. Do you have any breathing issues?
Students at PCOM learn whether their patient lives or dies.
You've chosen to use a non-rebreathing mask, is that correct? What you've basically done right now is smother her because there's no oxygen, there's a plastic bag on her bed.
You know, we're not scared to be wrong because of course you'd rather be wrong in this setting and learn from those mistakes before you go in to see a real patient.
Are you telling me she's in hypovolemic shock? This gives them a confidence level, a feeling like they've been there before. Obviously practice makes everything better. And for them to be able to practice here consistently and repeat sections of what they missed over and over and over again until they get it right, it's a really good thing.